Today, we're going to map the human body, but not with a satellite or a GPS. No, we're going to do it with our hands. We're creating a practitioner's guide to bony landmarks, which is really the foundational roadmap for any kind of hands-on therapeutic practice.
I mean, just imagine for a second. What if you had a GPS for the human body, a system of coordinates that could guide your hands with absolute precision? Well, that system totally exists. They're called bony landmarks, and they are the essential waypoints we're going to be exploring today.
So our journey begins at the very top, the cranium, which, includes the skull and the face. But before we start pointing things out, let's get really clear on what exactly it is we're looking for.
So, what are we actually looking for? Well, a bony landmark is a palpable point on a bone. And all palpable means is that you can feel it through the skin. It acts as a reference, a signpost for locating other stuff, like muscles or nerves. Seriously, just think of them as the "you are here" signs on our internal map.
Let's start at the back of the head with the neurocranium. That's just a fancy term for the bony case that houses your brain. As we go through these first few points, I really encourage you to gently feel for them on your own head. Go on, follow along. First, find the external occipital protuberance, or EOP. It's that really distinct bump at the very back of your skull. Got it? Okay, from there, feel for the superior nuchal line. It's a slight ridge that extends out to the sides. Next, move to the area right behind your ear to find the mastoid process. And finally, trace a line forward from your ear towards your cheekbone to feel the zygomatic arch. These are basically the major peaks and ridges of your skull.
Okay, now let's come around to the front of the skull, to the viscerocranium, or, more simply, the facial bones. We're going to focus on the jaw here, because it's such a common area of tension for so many people. Find the angle of your mandible. That's literally the corner of your jawline. Now trace that jawline up towards your ear. Just in front of your ear, as you open and close your mouth, you can feel that movement. That is the condylar process. Understanding these 2 points is absolutely crucial for any work you do around the TMJ, the temporomandibular joint.
From the head, we're going to travel down to the central pillar of the body, the spine and the ribs. This is the core of our entire structure.
In the neck, or the cervical spine, 3 vertebrae are really key locators. First, gently feel on the side of your neck, just under your ear, for the transverse process of C1. Now, find the first bony bump you can feel in the midline at the back of your neck. That's the spinous process of C2. Finally, trace down to the base of your neck, where you'll feel a much more prominent bump. That's usually C7.
Now here's a fantastic pro tip for finding C7. That big bump isn't always C7. Sometimes it's the first thoracic vertebra, T1. So here's the trick. Place a finger on it and gently look up. If the bone under your finger slides forward and kind of disappears, that's C7. If it stays put, you're on T1. It's a brilliant little diagnostic tool.
Moving to the front, we've got the rib cage, the body's own personal armor. Let's find the key landmarks on the anterior or front side.
We'll start at the very top. Feel for that soft little dip at the base of your throat. That's the jugular notch, and it's part of the manubrium. Now trace your finger down the center of your chest, and you'll feel a slight ridge or angle. That's the sternal angle. Keep going down until the bone ends in a point. It can sometimes be a little tender. That's the xiphoid process. A nice clear path right down the middle. And while we're here, let's not forget about the floating ribs, numbers 11 and 12. They're unique because they don't actually attach to the sternum. Now, why does this matter? Well, knowing their location is absolutely essential for any work involving the diaphragm or those deep lower back muscles, like the quadratus lumborum. All right, it's time to move from the core out into the limbs. Let's navigate the upper limb, starting with the shoulder and moving all the way down the arm. The scapula, or shoulder blade, is kind of like a floating anchor with a really complex coastline. Let's trace its most important edges. First, find the spine of the scapula. That's the prominent ridge running across your shoulder blade. Follow it out to its endpoint, the acromion process, which is the very tip of your shoulder. Then feel for the medial border, which is the edge closest to your spine. Finding just these 2 points alone gives you a powerful base of operations for working with the entire arm. Following the arm down, we get to the humerus. At the very top, you can feel for 2 bumps. Those are the greater and lesser tubercles. The channel that runs between them is called the intertubercular groove. And it's important because the main biceps tendon runs right through it. A little further down the outside of the arm is the deltoid tuberosity, the key attachment point for your deltoid muscle. Now let's get to the elbow and clear up a common point of confusion. The 2 main bony points are the epicondyles. The medial epicondyle is on the inner side. That's your funny bone. And the lateral epicondyle is on the outer side. Simple as that. Medial is toward the middle, lateral is toward the outside.
Continuing into the forearm, the prominent point of your elbow is the olecranon process. Just below that, on the outer side, you can feel the head of the radius. Try turning your palm up and down, and you'll actually feel it rotate. Pretty cool, huh? Finally, down at the wrist, those two bumps on either side are the styloid processes of the ulna and the radius.
We've mapped the upper body. Now for the final leg of our journey, the powerful structures of the pelvis and the lower limb. The pelvis has several crucial landmarks for assessing posture. At the front, you can easily find the ASIS. Those are the two bony points of your hips. If you trace that hip bone around to the back, you'll find the PSIS, often marked by two small dimples. And finally, the ischial tuberosity, which you probably know better as your sit bones. The relationship between all of these points is absolutely key to understanding posture and low back pain.
Let's take a quick tour down the leg. Start at the side of your hip to feel the greater trochanter of the femur. Moving to the knee, we have the patella or kneecap. Just below it is the tibial tuberosity. Finally, we arrive at the ankle. The inner ankle bone is the medial malleolus, and the outer ankle bone is the lateral malleolus. Our physical tour concludes at the very foundation of the body, the foot. Specifically, the calcaneus tuberosity. This is the large, palpable part of your heel bone. And it's a critical landmark because it's the attachment site for the Achilles tendon and the starting point for the plantar fascia.
So as we wrap up this whirlwind tour, just remember that these points, from the EOP on your skull all the way down to the calcaneus in your heel, they aren't just academic terms. They're the essential navigational points, the living map that every single practitioner needs to work effectively, safely, and with total confidence.
So you've been given the map. Now the question is, which landmark will you explore first to deepen your practice? Where will you begin?